Thanks. Welcome back, everyone. We're going to go ahead and go on to the reactor panel, and we'll hear from everyone, and then we'll start out with a discussion at which I'll offer the, after which I'll open the floor. And so I want to introduce our reactors. Our first reactors is Dean Hovey. He's CEO of Digifit. He has started numerous high-tech companies over the past 30 years from his base in Silicon Valley. He's known in the Valley for his creativity, product design, acumen, customer insights, having founded IDEO, and for his early work designing the mouse for Apple Computer. Next, we'll hear from, got an audience reaction. Next, we'll hear from Catina O'Leary, and she is going to speak from a foundation perspective, and she is the president and CEO of Health Literacy Missouri. Under her direction, HLM Service Network has expanded to include some of the largest employers in Missouri, including pharmaceutical companies, hospital systems, business coalitions, and community-based organizations. And lastly, we'll hear from the Department of Health and Human Services, Lana Moriarty, and she'll provide the government reaction. Lana is the Director for Consumer eHealth in the Office of the National Coordinator. Prior to coming to ONC, Lana helped manage the National Health Service Corps and the Nurse Corps programs at HRSA, while also focusing on supporting local NGOs working on HIV/AIDS education and prevention and rural community development issues. So, Dean, if you can start us off.
Well, I was actually quite... There we go.
Push the mouse.
Push the mouse.
It's the opposite.
But it doesn't move. I was actually surprised to get an invite to this because actually Washington, D.C. is a fairly foreign country from Silicon Valley. But it's great to be here, and as my career has evolved, I really realize how important the influence of the government can be in transformation, as we've seen with the Affordable Care Act as an example. I guess I was struck with a dilemma of sorts. The last 4 years I've been involved with Digifit. We started with fitness tracking, specifically heart rate monitoring, so people could go out and exercise and actually get a real-time heart chart created so you could see how fast your heart was beating. And if you're really techie, you get into the different zones at which the heart is beating, which allows you to improve your performance if that's what you want, or affect your caloric burn, etc. When I joined the company, that wasn't really what I wanted to do, and I changed direction to basically go more after health and wellness in actually helping people learn healthy habits. My background, early days was product design, and so user experience was very important. We were lucky enough to be involved with Apple at the very beginning, and as you know, Apple products have always been around engaging the user in a very special way. So we're trying to bring that to this domain. And the dilemma is that in mobile apps, one of the things you want to do is have millions of downloads and lots of users, just because the economics of mobile apps says that there's lots of free downloads and you convert some small subset of that to actual monetize them to make money. I actually wanted to get out of that business because it's really hard to make money giving away free apps. It doesn't take a lot of rocket science to figure that out. So we looked at human behavior, started specifically thinking about pregnancy, because it was a really neat niche in a way in that the user was very technologically savvy based upon their age, tends to be social. A dramatic change has come upon her life that she's often never experienced before, particularly a first-time mother. And the condition is very predictable, 9 months. So you have a lot of nice things going to figure out how can I create an interactive design that goes with this woman for the 9 months of her pregnancy to basically help her make the right decisions along the way. But the big part of that was the motivation piece. So that was one of the key issues, was how do you get people to do these things? And so we picked a life stage. A lot of what we're talking about here today is chronic conditions, which also at one moment of time kind of slaps you on the side of the face and says, gee, I need to do something about it. So what we wanted to do is to figure out how can we take that opportunity, because once you learn that fear factor or change factor doesn't last very long, how do you lead them down a path? And so we've created a platform that allows us to create what we call an experience design, which allows us to say, who is the person that we're targeting, and what is the outcome that they're trying to achieve, and how do we create a story arc? What is that story that takes them from here to there? And so we bring together experts in the domain that might be working with those people, interview them, go into the homes of the people that we're actually trying to influence, and understand what kind of information do they need, what kinds of things do they need to pay attention to, what is their social network, all of those pieces together to put that story arc together in a successful way. And our platform supports those issues and allows us to create step by step by step by step an experience that we can actually track what people are actually doing or not doing, and then allows us to iterate it, as we've heard before. You do the design, you iterate until you get it about right, and then you deploy it. So one of the things we realized is that each of these targets has a very specific need that you have to completely understand. And not only is it the individual, but it's the care team that's involved too. So not only do we have to bring technology into play, mobile phones, sensors, et cetera, but you have to create social change, social technical change with the care providers. Most providers have never been in a place where they had 24/7 data and be able to get into a person's home. So I think that's the big piece here, is how do you deep dive and interact and then make it available.
Thank you.
Good morning. I'm Catina O'Leary. I'm recovering from laryngitis and a little bit of a cold, so I apologize if a little scratchy. So in kind of a true reaction, first of all, I want to say it says here that I reflect a foundation perspective, but it's really more a foundation nonprofit perspective. So as a small company doing nonprofit work, the biggest reaction I have this morning is, where do we fit? What do we offer? What's the opportunity for us to engage with companies, with people? What's the kind of intersection of all of this work? Our work is in St. Louis. Health Literacy Missouri lives in a building called T-Rex, and T-Rex is this building where they've put hundreds of these kind of startups in one spot, and they've got all this space, and it's co-working space, and you know, when I get on the elevator in the morning, there are 27-year-old people who are in their t-shirts and their flip-flops and their whatever, chatting about what they're doing and what they're creating. And so there's a real energy in St. Louis around kind of this startup culture and this digital culture, and I'm in the hub of that, and it's really fantastic. But when I talk with them about what we do on the 6th floor, they kind of look at me with this very perplexed look, and they don't know how that fits. And even when they come down and talk to us, they can't quite see what our role is and what that partnership would be like. And I think part of it is we don't talk about it well. We don't know what we bring. But the other part is, in their also emerging discipline, they don't know where to put us. So figuring out kind of what those relationships look like and how we can inform and participate is really important. So how can we help? What can we bring? To some degree, you know, it's really great to hear someone talk about going into homes and doing this work. But for a lot of the people that I worked with for years when I was out in the community doing community-based, community-engaged research, one of the things I knew is that the folks who need it most wouldn't let you come in their homes. Really different use, really different need, and the embarrassment of what their home looks like and what the resources are and all those things. And so how do we then also speak for the most vulnerable in our communities, where that's appropriate? What do those links look like? So that's one of my most relevant reactions, I think, this morning. And then secondarily, at Health Literacy Missouri, we're doing a whole bunch of work in health insurance literacy right now. And we're talking a lot right now about, you know, heart rates and weight and steps and all these things. But what I know is, you know, people are really struggling to figure out this health insurance thing. They don't have any clue what they're supposed to get. I had a first visit to the ER with my 6-year-old this weekend. First time ever. I get there because I made the phone call. And when I made the phone call, the person at the nurse care line on Sunday said, well, your doctor really doesn't want you to go to urgent care. She wants you to go to the ER. So I get to the ER and I do all of that work there, and then they charge me $300, which is completely fine, and I should have known that, and I should have had all of these resources. But when I put on the hat of other people who aren't in this space and what that means and how they use those pieces of information and make decisions, I'm kind of floored by that. How do people figure out what they need to know? How do they show up with the resources they need? They don't tell you that at the desk, so what happens when someone walks in and says, okay, we've done all this work and we're taking you to the scan now, and you really need the scan because he's in a lot of pain, but don't forget you owe me $300. So where's the technology piece for that, and what's the kind of interface, and how do we work together? And then the final piece of this health insurance, one of the pieces of data that we're hearing in Missouri is that people are really using the periods outside of open enrollment to understand their health insurance, and they're going back to the people. They're going back to the navigator who enrolled them, the assister who enrolled them, and they're asking really direct questions that, one, those folks don't know how to understand. They don't know the answers to, but also they don't even have the information anymore. It's not there. It's not captured in a place that's usable. So I think we need to be talking about who these apps are for. I think there are multiple levels. So there's absolutely consumer app, but the provider apps, this doesn't just stop at a patient portal. There's something in community that we need, and all of these things that we're talking about privacy and resources and engagement, same things apply with also a vulnerable group of providers who may not have the same training about ethics and privacy and principles and all of those things. So how do we have a more broad conversation about technology as we use information? Thank you.
Thank you. Well, my head is just spinning and bursting with all kinds of ideas and information. My name's Lana Moriarty. As they said, I work over with a terrific team at ONC. Really looking at, we've been working on a consumer action plan for ONC to look at how we will sort of integrate the work across the different divisions and meet sort of what we lay out in the draft federal health IT strategy, as well as the interoperability roadmap, which is still out for public comment. But I think that for me, Reed kind of summed it up, that we look to the private sector constantly for the innovation, for things that are happening in the field, particularly with health literacy. And we try to find the best practices, try to bring those, to the table, make sure the right people are at the table. And that's kind of what my team has been very involved with in looking across the field and seeing what's happening. And I think when I was thinking about health literacy, I really go back to, sort of HRSA and being in the field with underserved populations. And I think it's easily overlooked when you talk about digital health literacy. You have to recognize that a significant proportion of the U.S. population struggles with computer literacy. And I know my team recently was talking with a provider in Tennessee who said, yeah, I have a patient portal, yeah, I'm meeting meaningful use, and I'm trying to get the incentive dollars the government's laid out, but the major issue is a lot of my patients don't have computers. And they don't even, some of them don't even know which computers to buy, and they don't, if they have smartphones, they may or may not be, downloading apps and accessing things that way. But even, we talk about, well, there are public spaces, privacy and security. These are populations that oftentimes are low income or marginalized, and sometimes in rural, sometimes in urban. But I really feel like that is a big piece of it, is it's not just thinking about access to broadband or, do they understand the health literacy? It's really, do they have the equipment? Is there basic computer literacy? So I think we need to also, consider that perspective. I was really thrilled with the 3 presentations and just looking at how consumers and patients are being used in design, because oftentimes we have design created with the assumption of this is what's going to help the consumer be healthier, stay healthier. And I really appreciate the fact that, this is about user-centered experience, user-centered design, and really getting at what do people need, what do they want to stay healthy. So I think that is a very key point. something that Reed showed us with Siri, I think gets at the heart of what we want, which is intelligent, structured data, because we do run the risk with accessing so much health information, we do run the risk of having people misinterpret and perhaps act upon misinformation. So I think that that's a really key point. And I think that for me, it's all of this, it's so hard to navigate across disparate sources of information. We touched on the patient portal issue, and I was happy to see healthfinder.gov taken to a new level with my preventive care and having that experience. It's really impressive to see how many people are using that, and I would love to talk with the presenter and just look at the scalability and the replicability of that piece, because I think that, you know, it's a complex, siloed reality of our healthcare system. And I know that it wasn't the government's intention to create 10 different portals for all of your different, you know, your primary care physician, your different specialists, but that is the reality we're living in now. So I think that what my team has been talking about is how do we now, instead of having the data sit in all of these different places and be siloed, it is your data as a consumer. You own that data and you have a legal right to that data. So how are we looking at an architecture that wraps around a person instead of having it in all these disparate places? So I think that is something that we're very keen to talk more about today and see how we can make that happen. Thank you.
Thanks. Now we'll ask our other panelists to join us.